Good afternoon, my name is Ensign Lankford and I'm with Ensign Nelson, and today we'll be performing the shoulder exam. So the first thing I would do for a typical exam is go through the history. So I would ask him if he's had any past trauma, where on his shoulder does it hurt, what does the pain feel like, does anything make it better or worse, has he done anything for treatment, and essentially just go through the OPQRST model that we learned in Foundations module, as well as asking if he had any prior shoulder issues or past surgery, some of his family history, different things like that. The next thing I would do is I would move on to inspection. So just looking at his skin and seeing if I notice any like bruising or any obvious changes to it, which I do not see. And then I would also look for anything protruding out, so like for example like a squared shoulder or something like that, but his do not look squared. So the next thing I would do is palpation. So I'll start by palpating first his clavicle, and then I would move on to the sternoclavicular joint, SC joint, and then I would find this little V notch here and palpate his AC joint, and then I'm going to palpate his bicep tendon right here. And then lastly, I find his bicipital groove and feel that there. So that's it for palpation. The next thing I'm going to do is conduct a range of motion exam. That's the next portion of this exam. So the first thing that I'm going to have you do is abduction and adduction, or abduction and adduction. So for abduction, I'm just going to have you put your hands up, and that shows abduction. And then you're going to put them down, and that's adduction. And then I'm going to have you pull them forward for flexion, and then go ahead and go backwards for extension. All right, so next for range of motion, I'm going to do external and internal rotation. So I'm going to let him do it actively. So if you want to go ahead and put your arms up like this, and then back, and then forward to external and internal rotation. All right, and then the next thing I'm going to do is the scratch test, which also shows external and internal rotation. So I'm going to have you put your hand back like you're scratching your back, showing external, and then you're going to put your hand behind your back, and you're not going to let me push it in, so you're going to pull out, and that would show internal rotation. All right, so now that I have done the range of motion assessment, the next thing I'm going to do is move on to the specialty test. So the first one is Mears test. So I want to make sure that his arm is in internally, and then it's just going to go up towards his ear, and we're essentially looking for impingement. So start here and then move towards your ear. Any pain?
No.
No. Okay. Then do the same thing on the other side. Then move towards your ear. Any pain?
No.
No. Okay. And then the next test that I will be doing is the Hawkins-Kennedy. So that is also again for painful like impingement. So then I'm going to do that. Just bring your arm here, and then okay. And we're going to go down. And we're going to do the same thing on the other side. And just any pain?
No.
No. Okay. All right. So that is done for that specialty. All right, so the next thing I'm gonna do is the empty can test. And that's, so first what I'm gonna do is put him in the plane of his scapula, which is the frontal plane. It's gonna be about like 30 to 45 degrees. So go ahead and put your arms like this. I'm gonna have you turn your thumbs over, and then don't let me push down. So this is testing his abduction, or essentially his supraspinatus muscle. So the next thing I'm going to do, which is going to test his infraspinatus and his teres minor, is external rotation. So I'll have you put your arms to your side. And what I'm going to do is I'm going to stabilize his arm, and I'm going to essentially internally rotate him, so he's going to have to externally push against me. And then I'm going to do the same thing on this side. So I'm going to internally rotate him so he externally pushes against me. Okay, now I'm going to measure the subscapularis muscle. So that is internal rotation. So I'm going to forcibly have him rotate externally, and when he pushes back against me, that's internal rotation. And I'm going to do the same thing on the other side to measure that. Next thing I will do is the posterior impingement test. So I'm just going to have your arm come back here. And we're just going to have it come backwards. And do the same thing for the other side. This way, go back. Any pain?
No.
All right, so he has no posterior impingement. After that, what I'm gonna do is the bicep test, the first one. So I'll have you stick your arms out like this. Don't let me push down. Don't let me push down. So that essentially could be one of two things. So the bicep attaches to the superior labrum. So either it could show something wrong with the bicipital groove, or it could show potentially a slap tear, but no pain with that. So the next thing we're gonna do is the apprehension test. So what we're gonna have you do is lay flat. And then go ahead and scoot over this way just a little bit so your arm's hanging off. And I am just going to bring you back here. Any pain? Okay, since the apprehension test was negative, I don't have to do the relocation test, but if I were to do that, I would just essentially stabilize his shoulder joint, and it should decrease the pain if he had any, but he doesn't have any pain. So the next thing I'm going to do, you can go ahead and sit up, is I'm going to do the second bicep test. So if I can have you go ahead and go here, and then don't let me pull. And then don't let me pull. So what this does is it is indicatory for a slap tear. And the way it measures that is that it's no longer going at a 90-degree angle, the bicep tendon connecting to that, but it is now straight, so we're not looking at the bicipital groove anymore, we're just trying to measure a slap tear. All right, so the next part to indicate a slap tear, another test that I can do is the O'Brien's test. So what I'm gonna have you do is extend your arm out here, and I'm gonna have you put your thumb down, and essentially this pronation will have your bicep tendon stretched fully out. So if you do have that slap tear, it should be painful. Pressing down on here, and then supinating should relieve the pain if there is a slap tear. And then the last test that I will be doing is the scarf test, which is indicative of an AC joint injury. You typically would get an AC joint injury if you fall directly on your shoulder. It's either an AC joint injury or a clavicle fracture. So I'll have you go ahead and kind of like you're putting on a scarf, and don't let me push down. Okay. And that concludes this shoulder exam. Thank you for watching.